why can't it be transparent when there's an insurance company involved? And I've had this experience. Bimal, whom you've met, has had this experience where we go into a hospital and they just cannot answer how much is this procedure going to cost. Why is it so difficult to get that answer?
Um,
Because it's frustrating.
so I guess my question is, and my dog is answering, but I guess my question is that, you know, so the cost of care is finite, right? There is a cost to a procedure. There is a cost. But if you knew that cost, would you buy insurance to negotiate it?
I guess it just depends on the cost.
It depends
But
on
I've
perfect.
seen many
That's
bills where it just
exactly,
doesn't
you
matter.
just gave me the answer.
Hmm.
It depends on the cost. So if I didn't tell you what that cost was,
Hmm.
you would have no choice but to
Right,
pay a premium.
right.
So you see how, like,
Hmm.
transparency,
Hmm.
why is it this way? I don't know. When I started practice, when I set my fee schedule, they said, okay, your fees are going to be set, 2.5 times Medicare. I'm like, what? What does that mean? It's like, in other words, if your fee was $100, if you were going to get the Medicare allowable was $100 on something, your fee was $300. Like, well, why? Well, I'm like, why?
Right,
Why?
right.
I'm just asking. They're like, oh, because this is the way it is. This is the way it is. So all the time I thought this fantasy that there's some insurer out there that's going to pay me the big
Yeah.
amount, because that was what they told us. Well, some insurers pay more, but no one really pays the fee that we set. And then I realized the fee that we set is because the insurance companies encourage us to do so, because then they can turn around and say, hey, look, she's really expensive. This procedure is going to cost you $500, but because you have insurance, we're going to take care of it, and we're going to bring that cost down to like $200, whatever.
Hmm.
They're going to bring the price down. So that negotiation, I think, is part of why no one can give you the answer. And the people at the front end really don't know the answer. The best they can do is look at the fee schedule, and my charge master is going to give you that crazy price. If somebody looks up my charge master, they say, oh, she charges $5,000 for that. It's like, that's just this crazy fee that's way higher than we collect.
Right.
So yeah, so it really is the opacity in the system is set so that insurance becomes more relevant. It's weird because when you get car insurance, I go to my mechanic. I have this wonderful place that fixes my car when I dent it, and
Hmm.
they tell me what it's going to cost,
Right.
and and I know my deductible. It's like,
Yeah, it's
it's
straightforward. Hmm. Yeah.
and the system, when it gets layered, because now
Hmm.
it's not just my surgery, it's my surgery, but you need anesthesia, you need a pathologist, you need, there's other fees that are attached to it. So then and all those fees are finite as well, and fairly routine, like
Hmm.
they're fairly repetitive, give or take a few codes that you might add or subtract. Most of the time it falls in a range, in a bell curve.